Welcome back to Open Globe Talk. This is your host, Rosdahl, and I'm joined today with Dr. Jullia Rosdahl, who's an incredible glaucoma specialist and associate professor of ophthalmology at the Duke Eye Center. She's a dear mentor for me and many other students who found her guidance both helpful and spiritual. Dr. Rosdahl graduated from Case Western Reserve University School of Medicine and completed her ophthalmology residency at the Mass Eye and Ear. Afterwards, she completed her glaucoma fellowship here at Duke and had decided to continue staying. So this is a wonderful place to put down your roots, Dr. Rosdahl. And thank you for being here.
Oh, it's my pleasure, Rosdahl. Thank you so much. I'm so honored to be on your program.
So Dr. Rosdahl, something that I ask all of my guest speakers is what initially drew you to ophthalmology?
Well, I love this question because I actually didn't know anything about ophthalmology when I started medical school. I really kind of thought I was headed to maybe pediatrics or something like that when I started, because I really liked kids. And then I did an MD PhD program, and the way it was set up is you do your first 2 years of med school, and then you join a lab, and then finish up med school after finishing the PhD. And the lab I picked was one based on the science. It was a cell adhesion and cell signaling lab. Suzanne Brady-Kalnay was my mentor. And when I started in the lab, there were two model systems that I could choose from when I was starting my project. And one was in a prostate cancer model, and the other was in vision. And I thought, oh, that visual system sounds more interesting than the prostate, so I'll pick vision. And so then I spent the next 4 years studying retinal ganglion cell biology and development, and how cell adhesion and signaling helps those retinal ganglion cell axons make their way from the eye to the brain, and got hooked on vision at that point. So I was really lucky to kind of find it through science.
And now you did a MD PhD track, and it's one of the bravest paths you can take because you're committing to both medical school and a PhD. But at the end of this, you have to pursue a residency for the most part. And I'm wondering, for anybody who's pursuing a similar path, what are some aspects to keep in mind when you're thinking that your research is going to play some part in you getting into the residency eventually?
I love how you think that I was so forward thinking when I really wasn't. I think I kind of took each step thinking like, oh, I would really like to study this and learn this. And I think that the jobs that these people have who have these degrees, would be really interesting. So when I was in college picking my next step, I, knew professors who were PhDs, and I knew of physicians who were MDs, and I had heard of this triple threat, being an educator, a physician, and a scientist. And I thought, oh, all those things sound really fascinating. I'd love to do those things. And so I thought, okay, I need to get an MD and a PhD. And then I just took each step based on what was really interesting to me and the people that I wanted to work with. So in terms of suggestions, I guess I would say it is a long road. And it's good to know what your ultimate goal is, but at each step to be doing things that you really enjoy and that you're passionate about, because it's a marathon, not a sprint. So you gotta keep going. And I think the other thing for me is, you don't necessarily stop doing, personal things when you're working on your professional development. Along the way, I got married and had children, and I've had other life experiences that been really, obviously, wonderful and important.
Yes, and that's actually a lot more important to keep in mind that personal life kind of goes in line with your career life. What are some interests that you have within ophthalmology and specifically glaucoma?
Yeah. So, the reason I got into glaucoma, ophthalmology, and then glaucoma was really my love of retinal ganglion cells. I studied them in my PhD, how they were born and developed, and then picked glaucoma as a subspecialty because I get to try to save retinal ganglion cells, every day with my patients. So I'm always interested in, what's happening with retinal ganglion cell neuroregeneration and neuroprotection. And I really thought that we would have some of treatments based on those ideas at this point in my career. So that is disappointing to me, but does really feed into one of my other interests of patient education, because glaucoma is a disease that doesn't necessarily cause symptoms until later on. And to cure glaucoma blindness, really to reverse the vision loss, we need therapies that target the retinal ganglion cells and bring them back to life. So hopefully the things that we understand about patient education and communication will translate well when we have these treatments to reverse those changes, so that I'll be part of the team bringing them to patients, even though I'm not necessarily discovering them myself. And I think one of the other things that's really interesting to me right now, that I feel like I'm learning more about and trying to keep up with, is the idea of lifestyle modifications that might help glaucoma, as well as how the social determinants of health and disease can affect glaucoma. I think this is something that isn't really well understood, and is kind of a newer area that has a lot of potential to help patients.
I've actually watched you work with patients, and something I really love about your method is whenever you speak to patients, you talk to them very calmly. If there's a patient coming in with certain social determinants of health, and they've already been to another physician who doesn't understand that, you take the time to really walk them through their, I guess, misunderstandings, and treat them like this is their first time walking into the clinic. And as you mentioned, glaucoma is an irreversible blindness. You have to diagnose it early. That is the key to kind of stopping glaucoma from kind of affecting quality of life. So what are some techniques you have, or you know of, that you practice daily with patients coming in from certain risk factors, that you think that could help other physicians that are practicing glaucoma or other types of eye conditions that are also irreversible?
Oh, well, I am humbled by your thought that I could teach other physicians. But thank you for those kind words about the things that you've seen, when we've worked together in clinic. I think that my main strategy is to really treat that relationship as a partnership, that the patient and I, and typically their family, we're really working together to figure out a treatment plan that's going to work for them, and help facilitate as much as I can, them being able to follow through on that. And so I draw on some skills that I learned through a coaching program, which really served me well in talking to patients and working with them to work on finding strategies that the patients come up with themselves, and I'm just a helper, supporting the things that are going well for them and the things that are not going well, and sharing ideas that I have about things that are not going well and how they might be able to fix them. And I honestly get my best ideas from other patients, that I share with them. Sometimes those other ideas work for the patients, or they really spur some creativity for a patient themselves. One of my favorite ones is this patient who has to take bromonidine 3 times a day. It's tough to take anything, 1 time a day, let alone 3 times. And so he had created this block of wood and drilled 3 holes. And so he would move the bottle to each of the next hole to let him know that, okay, I took it because I've moved it. And I really enjoy thinking of him creating that and using that, and then sharing that with me. And I share that with other patients. And I think that that can sometimes, help them come up with ideas that work for them.
That is really interesting. In 2019, you authored Outlook, which is a collaboration with the National Eye Health. And I just wanted to kind of ask you how that got started, and what does that work kind of entail for you and for patients?
Oh, I love that you asked about this, Rosdahl. NEHEP, or the National Eye Health Education Program, is kind of the community outreach arm of the National Eye Institute. And it's been going on for decades. I got involved in 2014. And then in 2015, I joined the planning group, which is experts in ophthalmology, in optometry, and in community outreach, this planning group. And we work with partners, essentially national organizations that have an interest in eye health. And I joined the planning group in 2015, and then in 2020 was honored to be the chair of the planning group. So I really love NEHEP and the work that I get to do there. So it involves being a subject matter expert when they're revising the National Eye Institute glaucoma pages, being able to do radio interviews during Glaucoma Awareness Month, which was in January, getting to do webinars and that sort of thing. Last year, I got to do host or be the moderator for a webinar for the vision rehabilitation, the Low Vision Awareness Month. So that's really fun. But I think the best part of the work that I've been able to do with NEHEP is with some of those NEHEP partners. So one of them's Hadley, which is a nonprofit that creates resources for people with low vision. I got to do a podcast with them on glaucoma a couple of years ago, and they also helped us with the American Glaucoma Society program. They helped to create kind of a glaucoma landing page on their Hadley resource website, so people with glaucoma can kind of go to that landing page and get a more curated list of resources that might be useful to them. We've got another project brewing with Hadley too, and then another partner through NEHEP that we've gotten to work with is Bright Focus. And over the last year or so, we started these monthly glaucoma chats where people with glaucoma or people who love people with glaucoma can call in and listen to an expert talk about a glaucoma related topic. So NEHEP has been really fantastic for being able to kind of really help at the national level, spread the word about glaucoma and eye health, as well as do really fun projects to spread that news as well.
I love that. And I truly think that you're very passionate about medical education. And a lot of times that is really what patients need, especially, when we're talking about underserved patients. I just had a conversation with Dr. Chaya, and he's also glaucoma. So this is going to pair really well. And I'm curious to know, on the eastern side of this country, how do you deal with underserved populations? Glaucoma is a tough one because it's a chronic disease. You have so many drops, and you have to come to appointments. You have to work with your provider to, manage the pressures. And now, there's other imaging and modalities to help assist with what is going on. So how do you, as like a glaucoma specialist on the East Coast, deal with that?
Yeah, well, you certainly laid out the challenges really well, Rosdahl. I think that we do have a couple good things in glaucoma. One is that a lot of our medicines do have generic options, and there usually are ways to get them fairly cheaply. And there are also programs from the drug companies to help get patients, especially low-income patients, some of the newer branded products as well. There are hoops to jump through, but the drug companies are really invested in getting their their products into patients and saving vision. So kind of ways to get drops, definitely some hoops to jump through, but I think that really partnering with patients to know what it is they need and what the barriers they're experiencing are so that we can address them. Cost is an issue. A lot of programs do have charity care programs that you have to sign up for and be enrolled in, but do allow you to get care. Duke has a program like that. And then there are other programs to help people really with that, first part of like getting the eye exam and getting the diagnosis. So a national program that the other glaucoma specialists might have mentioned too, there are a couple of national programs. One is the Eye Care America program through American Association of Ophthalmology, soup straight. And then the American Glaucoma Society has a program called AGS Cares. So through Eye Care America, you can get an eye exam with a participating ophthalmologist. You sign up for that program online. And the AGS Cares is a program to help cover the cost of glaucoma surgery by participating doctors. And the American Glaucoma Society website has information on how to sign up for that. But I think one thing that people don't necessarily know is that Medicare and Medicaid do cover eye exams. And so people with those insurance companies or that type of insurance can get eye exams. It's not necessarily that you need kind of a special vision coverage for that eye exam.
And just for our listeners too, if you were listening into Dr. Smith's, who's another glaucoma specialist, she also mentioned AGS Cares. So we have two glaucoma specialists vouching for a great program. And all the resources that you've mentioned, Dr. Rosdahl, are new to me as well. And so this is going to be a fantastic resource to add. So going over to another passion of yours, which is medical education. Now, this is not related to patients, but rather to students. And, as you went through supporting medical students and organizing, different activities for them, what do you think as the field for ophthalmology has changed so much in terms of how we need to prepare students for residency or perhaps expose them? Because ophthalmology is one of those very subspecialized areas that only we get into either at the end of third year or the beginning of fourth year. And if somebody isn't lucky enough, then it's like never.
Yeah, well, I do feel like we're lucky in that the eye is just so wonderful and vision is so fascinating, not only to those of us like you and me who know and love ophthalmology, but anyone, if you give them a moment to think about their vision and their eyes and what that means to them, they do agree with us that it's such an important site. And so I think just giving people that opportunity to think about that and show them a little bit about what the eye can do and what an eye exam can do. If you let a student see over your shoulder the little peak of the optic nerve and the retina, and just note how that is actually part of the brain that you're seeing, that's actual neural tissue and blood vessels. I think anyone, even someone who's going to be a wonderful nephrologist someday or neurologist or pediatrician, that's going to be exciting to them.
I'm so glad you mentioned being able to show the anatomy, because a lot of times students will go into rotations and maybe they may not know exactly what to look at. There might not even be a teaching scope. So that's a really important aspect, because I personally got inspired by having technologies assist me in seeing what the surgeon was seeing. As someone coming from a background with no family members in ophthalmology, and I know that you're also, the first ophthalmologist in your family, how did you go about seeking mentors and, thriving in this field? I know you mentioned your mentor from your PhD, but that's kind of like, it's still something that must have confused you at the time.
Well, I definitely believe in that maxim that kind of being really lucky and also being kind of ready, those two things together really is where the magic happens. Because I do feel that I've just been really lucky in the people that I've stumbled into, picking people that I thought were nice and friendly and doing interesting things, and mentors that I thought would be interested in me as a person and helping me in my career. And so that happened with my PhD mentor. She was a relatively young lab mentor. She hadn't had a lot of students before. It was a small lab, but I was really inspired by how hardworking she was, how smart, how organized she was. And I thought, oh, I think I would get a good experience with her. And then, got introduced to people in the vision science training program, during that PhD. So got to shadow some ophthalmologists, and then people along the way that have just been helpful to me, who did things for me that I didn't even, I think, appreciate at the time. One of them is Dr. Suber Wong. He's a retina specialist in Cleveland, and he was on faculty at Case Western. And he was so kind. He didn't have any reason particularly to help me, but he read over my personal statement and gave me really fantastic feedback. And then actually eventually, 15 years later, he was in NEHEP as well, and I got reconnected with him, and he remembered me, and I of course remembered him because he had given me that feedback, and helped me, and so you just don't know how people are gonna help you, but just being kind of ready and being lucky. And then in ophthalmology at Mass Eye and Ear, they have a mentor program where they assign you a mentor based on your interests. And so my mentor when I was a resident was Dr. Teresa Chen, who's just an outstanding, amazing glaucoma specialist and amazing surgeon as well. And so it was really special to get to be under her wing. And now I get to consider her a colleague, not just a mentor. So I feel like I've really just been lucky. I haven't been smart enough like you to go out and find people. I've just been lucky with the ones that have been in my path.
You're plenty intelligent, Dr. Rosdahl. And I do agree with you that mentorship, the way you described it, is really important. And being with people who really are kind and thinking of you is always very important. So one last part of our conversation is something that, I wanted to build on the humanistic side of ourselves. We often go through medical school wanting to become the best physician we possibly could so that we could get into residency, but really the goal should be to become the best physician we can for patients. And what part of that humanistic side do you think we could develop more as you see medical students going through a very competitive process?
Yeah, well, I think that you hit the nail on the head with, remembering that you need to take care of yourself so that, you can be that doctor caring for other people. And so I think that self-care is really important. When I think about what kind of self-care, residents and trainees need, I think it's really basic. Like if you're feeling stressed, do you need to go to the bathroom? Do you need a drink of water? Do you need to eat? Do you need a nap? Really check in with your body, since I think so much of our training makes us disassociate from ourselves and not realize oh my gosh, I haven't drunk anything for 8 hours. That's why I'm not feeling well, and I feel uncomfortable and stressed, and I'm not really being my best. It's because I'm not taking care of my body. And so I think, self-care means different things at different stages, but I think for a trainee, really, getting down to the basics and taking care of your body and listening to it. And then one piece of advice that I got when I was a resident that I treasure and I still use was to create a mission statement for myself. a mission statement of what I wanted to do with my life, both personally and professionally, like who I wanted to be. And that's something that does change over time. But it was an exercise that I did as a resident, and I think really helped me as a fellow. And then when I was thinking about next steps, the career path that I had set myself on, was that still what I wanted, and did I need to change? And then how it is with me in clinic. I try to bring that with me in my day-to-day life as well, to think about what do I need to feel like I'm being the best doctor I can be. And also at the end of the day, do I feel like, wow, I've had a good day and I feel good about what I did and who I got to connect with and who I got to talk to. So those are my advice. Like, pay attention to your body. If you need to eat, drink, go to the bathroom, or take a nap, and then think about a mission statement of what you want to do with your life.
That last part was something that caught me off guard, because I have never made a mission statement before. It's in the back of your mind, but you're so unsure about the next steps. It's hard to make a mission statement. So when you say a mission statement, do you mean like the ultimate goal of what you're going to be, or how is that framed?
Yeah, so I think that it's really a way to think about and state what your priorities are, who you want to be, and what you want to do with your time. And I wish I would have brought my little card. It's in the other room, but I can tell you what my mission statement is right now. And I wrote it down. I did a reflective practice actually just this summer to kind of renew for myself. And I kind of updated my mission statement. But I can tell you it's about being creative, and it's about being kind and curious. And it also was about my commitment as an educator, but also as a learner and as a physician, to be the best doctor I can, but also to be, a good mother and wife and daughter and community member too. So I would say just do it. Don't try to be perfect. Definitely the enemy of good is perfect. So just write. It's just for you. I do it in pencil so that I can change it if I want to.
That's excellent advice. And I'll definitely try this. I'm always very, impressed by your creativity, and our concluding kind of topic that I wanted to mention to our audience is your love for fabric and how much you do in yarn work. And it's like, I've never had somebody who was vocally about, talking about their hobbies. And I was curious, what have you been doing this past, semester, as you were going through the winter?
Well, thank you for asking me about my yarn hobbies. It's sometimes an expensive hobby, as my husband will tell you, but I think that it's fulfills me in so many different ways that it's worth it. So thanks for asking about that. So the most recent things I've been working on, I was doing some traveling. So I had some flights, so I needed some small projects, and I actually have been making some hats. I'm a Girl Scout leader, and our Girl Scout troop is going to Europe this summer. And so we're going to have a yard sale to raise some money. And I thought, okay, I'm going to make something that we could sell at our yard sale. So I've been making hats. And then here at home, where I have like a bigger basket where I can tuck a bigger project, I've got an Afghan that I'm working on. So those are my yarn projects. And you are welcome to come snuggle for movie night. I have lots of Afghans, some of which I've made and some made by other people, but lots of fabrics and soft things here at my house.
I would love to actually learn how to do it, how to do the yarn work in the first place, because I've always been interested in creating things. I guess this podcast is one of those things, but it's fun to have something, there in your hands that you can give to other people. It's a piece of you. And thank you, Dr. Rosdahl. I wanted to have you on for such a long period of time. I thought that you would be the perfect physician to emulate the qualities that I envision in somebody who's, in general, a specialist, or even a primary care provider. You're just so warm and appreciative of the patients. I've never seen you be rude to any patient, and that is something that captivated me and inspired me to have you and your voice be kind of resonating throughout these different podcasts you've been on. So you're an incredible educator to look up to.
Well, thank you, Rosdahl, for this honor to be on your creative endeavor. It's certainly making the world a better place, bringing your ideas and guests and thoughts out to us. And it's been just such an honor and a pleasure to be on your podcast and also get to know you. I'm very grateful to have you as a colleague.
Thank you. All right, guys, take care.